I'm here today with Dawn Armstrong from Human Good. She's the Chief Security Officer. And my name is Katie Griffith with Bright Solutions. We are excited to just talk today about the HIPAA proposed rule changes that have come out for 2025. So we hope that this conversation will really provide information to senior living operators as they look through the proposed changes and start to prepare for them. So thank you so much, Dawn, for speaking with us today.
Oh, absolutely. I'm always happy to chat with you, Katie, and always happy to hang out with you.
Awesome. The feelings are mutual. Thank you so much. So first of all, just tell me or talk about where you think this is coming from. Like, why are we having these changes proposed and where is this coming from? Why is this happening in your opinion?
Yeah, for sure. So these rule changes are being proposed by Health and Human Services, the Office of Civil Rights, and they're being made in response to the growing frequency and sophistication of cyber attacks, which have been targeting the healthcare sector more and more and more over the past couple of years. Obviously, HI is a very valuable piece of information for cyber criminals, and there's been this huge increase in ransomware incidents and data breaches, and we've all heard the big news, that all unfortunately keeps coming out frequently about these millions of patient records that have been compromised. The last major change to the HIPAA security rule was in 2013, and technology has evolved significantly over since then. It's been that's like 11 years, right? And both the red hat, the cyber criminals, and the white hats, the good guys, have advanced with all of that technology, right? HIPAA rules need to really keep up with that. The current regulatory framework really lacks specific and enforceable cybersecurity standards, which leaves many of the covered entities and business associates with kind of like this inconsistent level of security. There's just no, one organization might have this much and one have this much, really depending on probably something to do with their resources that they have available to them, right? So these proposed changes focus on modernizing cybersecurity expectations by incorporating best practices, mandatory encryption, multi-factor authentication, and a big one is enhanced risk analysis, which we don't typically have to report on, right? So hopefully that's going to make a big impact.
Great. And what is the timeline that they're saying for these proposed rule changes?
So interestingly, the publication for the new rulemaking proposal, which they give this cute little acronym of NRMP, I had to look that up, that came out on January 6th. And you could make public comments either via snail mail or online, and that closes March 7th. It's a 338-page document with all these proposed changes. Once those public comments come out and are reviewed, the final rule issuance is estimated for the end of 2025 or very early in 2026. Obviously, we have some uncertainty in our federal government right now, so who knows if this will be impacted by anything in regards to that. But the concerning part for me is that once the rules go effect, the proposed enforcement date is only 60 days after that, which doesn't give a company a whole lot of time to implement it, right? Especially if they weren't really looking at it and this was a surprise, or if they have a big lift, right? And then there is a huge BAA component to this, and they're going to ask that be compliant within 180 days, which in my opinion is still a pretty short period of time, especially for business associate agreements.
Yeah. Generally, how likely is it that the proposed rules will change very much to what they actually end up implementing? I don't know if you have a sense of that at all, since it has been so long since any changes have been made.
You mean based on public comment, you mean?
Yes.
I'm hoping that there will be an outcry from the community asking that 60 days is not enough time to be compliant. That's my hope of what comes out of a lot of that public comment. Some of the 338 pages has to do really with nomenclature and the more specificity around all of the acronyms and different technologies because they're pretty vague and really what can be wildly interpreted with the old rule. So those probably won't change all that much. I suspect there is an AI component to the proposed rule changes. I have a sneaking suspicion that there will be a lot of public comment about that. Where that will go exactly, I think is TBD.
So what are some of the big ones that kind of jumped out at you? I know you've had a chance to review, of course, you've been diving into the proposed changes. Are there some that are really jumping out at you that you're focused on?
The BAA part is a heavy lift as far as I'm concerned. I've already had a chat with our legal department, and the proposed rule is a requirement for much stronger business associate agreements. And part of the requirement is that the related entities such as CCRCs, which is, the business that we're in, we would have to verify that the business associate has actually deployed the technical safeguards required. Today's BAAs, right, you say, well, you have to have policies and procedures in place stating that you have all of these safeguards in place. So, policies and procedures are virtual pieces of paper, which people can either do or not do, right? But this actually requires that me as a chief security officer, I would need to ensure that that business associate actually enacted those. That is a huge ask. It's kind of mind-blowing. Like, how would we even go about doing that? So,
So you're becoming an auditor
yeah, that's just a monstrous ask, in my opinion.
without a lot of specificity. So I know you talked about like a lot of these proposed changes. I do think it's great for them to have a bit more clarity on how they expect rules to be implemented because it is across the board. It's a wide spectrum of like how different organizations interpret the current rules. So it's nice to have more specificity, but how specific would it be for the BAA? Because if you're going and now you have to audit these BAAs and I don't know, make a decision of if they are in compliance or not, seems like a really heavy lift.
I completely agree. And part of that is also, you have to conduct annual risk assessments on all of the business associate agreements you have. I mean, to me, that's like a full-time job, right?
It is.
I haven't been in this industry for a very long time, but from what I've seen over the past few years is that a lot of organizations, they have like 20, 30, 40, 50, 60 properties. And if those properties are spread out over various states, you're using different providers for pharmacy, for therapists, for whatever, and all of those you have BAAs with. So, you might have like 20 different BAAs just for physical therapists. So, and a lot of those entities, right, like a lot of the physical therapy companies, like especially in some of the more outlying areas like Boise, for example, right? You might only have one or two choices and they might be small businesses. So yeah, I'm not sure how we're going to address that because those companies, they probably have like a couple of laptops, right?
Right.
So yeah, it's going to be kind of interesting.
Some of the things I noticed in there are multi-factor authentication, which whether we like it or not, there's still a lot of senior living organizations that don't have MFA rolled out, which is not good. But, that's kind of a bit of a big lift for someone to have all of their employees start using MFA, even though I think they should already have it in place. But
I think MFA, generally speaking, is becoming more prevalent in our personal lives, right? Because like you can't really get into your bank account now without some sort of text message or verification app, right? Which is a good thing. But So I think everybody kind of understands at least the concept of it. Maybe they're not applying the acronym to it, but we've tried to enact MFA over the past few years, and we get a lot of pushback from clinical because they're out there, they're charting. If we're logging them out constantly and then they have to MFA to get back in, that just takes more time for them. And time is of the essence. I mean, they're trying to take care of our residents and patients. And so they're not fond of it. I know that a lot of larger hospitals use key cards, right? And so they just tap their card. We have looked into that, and it's an expensive ask.
It is so expensive.
Yeah.
It is clearly the easiest solution, for the person on the front lines. Like that is so nice for them to be able to do that, but it is so cost prohibitive. But it's
It,
hard when you have those shared devices because also a
yes.
lot of times you have a clinical person that needs to use a shared laptop and you might have policies in place like we do not allow you to look at your phone while you're at work. And then all of a sudden we have to do MFA somehow. And I mean, there's,
Right. So how
you
are
have
you
it
going to do
cost.
that?
All of
Yeah.
a sudden it's like, okay, everyone get your phones out. And, a lot of times they're personal devices. Like you don't have a company issued phone. So,
I'm not in HR, but my understanding is that the minute you have to use your personal device for work, I think there's implications there. How else are you going to do that validation? Right.
mhm.
And then the shared devices that you speak of, not only are there laptops, but we've really had a big push to go mobile in the last 12 to 18 months. And so we have like a lot of shared iPads out there. And shared iPads, like the fingerprint doesn't work for shared devices. Face ID doesn't work for shared devices. So we've actually just like literally like a couple days ago started poking around with possibly using NFC with YubiKeys. I don't know if you, I think I have my YubiKey right here. Like a YubiKey is like a little kind of dongle thing. But we're finding that that's possibly going to be an issue because some of the newer iPads that come out have ARM processors and these are not compatible with the ARM. So it's just like this continuous, like you keep getting roadblocks thrown up. And yeah, I don't know, we may just end up going to cards and having to suck up the cost. I don't know. I mean,
Right.
it's going to be really interesting.
Yeah, and some of the things as far as having to do vulnerability scans every 6 months, pen test every 12 months, some of these things, maybe it's a good idea and you want to implement that anyway. But I guess with the rule, it being in the regulation, now you have to have a reporting mechanism to show that you've done that and to keep those records, which I think just adds administrative burden. And one of the things it was saying that you have to the workforce access notification where require notification within 24 hours when a workforce member access to PHI is changed or terminated.
That's insanity. Say that you have a CNA that gets promoted or she moves to a different, even if she moved or he moved to a different community, their access is going to change, right?
Right.
So I have to tell somebody in some government
Within
office
24
somewhere that
hours.
happened in
Within
24 hours. I mean, and you and I both know, like, I know from what we do with CMS and things like that, government agencies are not technically prepared. Like, if you can give me an API that I could send that to you, I could probably do something to automate it, right? But if you're
Mhm.
going to want me to go on a portal and type it, like, no
Right.
way.
Log in and enter in the text. Yeah.
Like, there's just no way.
Oh my goodness.
They might be putting the cart before the horse there a little
Mhm.
bit, but I understand why they want to do that because they want to make, I don't know, I'm speculating, but they want to make us responsible for tracking those changes. But, EHR systems have audit logs, right? So if somebody goes in and changes the permissions of somebody, it's in the audit log. So why can't we just be required to save those audit logs for a certain period of time, right?
So I think in general, any provider today, they need to have looked through, and if they haven't, go ahead and look through the proposed changes and really think about, it's not that you're necessarily going to enact all these changes until it's all finalized, but you need to very much have a plan in place and kind of see where are our gaps and do a gap analysis and then kind of a plan to get into compliance should they go through.
Absolutely. I think that even just kind of understanding the general overview of the asks, the different asks, right? Like network segmentation, making sure that IoT and MIoT devices are completely segmented, and you have to document the segmentation, understanding all of those pieces and where your gaps are, and kind of start to wrap your mind around, okay, how would we address that? I think is like step one. Because if they enact these changes at the end of 2025 and you get 60 days to do it, there's no way. Even if you don't have any internal information security people, right? If you rely on an MSP or whatever it is that you rely on for your security, that's not going to be enough time. Doesn't matter who it is.
That's right. I agree. And yeah, I feel like sometimes when I speak to organizations, not all the time for sure, but they say, well, all our data is in the cloud with our solution providers. So it almost feels like they don't feel like they're super responsible for the security of that. So, if my EHR is in the cloud, how much can we just say, hey, I know that our vendor is really good at securing our data versus being proactive and what's our responsibility?
If you think about it, right? So if you're using a managed service provider or a SaaS provider to handle your data. So if you're using a EHR that's in the cloud, so you're going to have a BAA with them. So, but now this rule is taking that one step further where you're going to have to make sure that they are taking care, that all of their precautions are in place, right? But also the security rule says that you must encrypt data in transit and at rest. So how are you making sure that that's happening? What are you storing on site, right? So what are you doing with your fax machines? Like the rule also actually talks about fax machines and copiers, right? So, people scan things on copiers, they copy things. Some copy machines have fax machines in them, right? The new proposed rules are actually really going to drill down on that simple thing that all of our skilled nursing relies on is these incoming prescriptions and orders and things like that. And we're going to be responsible for that hard drive in that photocopier. So like what happens when you decommission a photocopier?
Mm-hmm.
So I've asked my guys, we actually just are in the middle of a copier refresh, and I'm asking my guys to rip the hard drives out of the copiers and we'll destroy them in a certified manner. But not everybody thinks about that.
That's right. Great point. Awesome. Well, thank you so much for your time today, Don. I think this is going to be really helpful as folks are looking through these changes and thinking about how they need to prepare. So I really appreciate you being so forthcoming, and I always enjoy our chats. So thank you so much.
Absolutely. I can talk about cybersecurity all day long.
Well, it sounds like you're going to get to later this year.
Unfortunately, yeah. Yeah. Thanks,
Great.
Katie. Appreciate it.
Thank you, Don.